This lice treatment shampoo is used to treat tiny insects called lice that can infest and irritate the scalp, pubic area, or body. It works by paralyzing and killing lice. It is important to use the shampoo as directed by your healthcare professional to effectively get rid of lice. Typically, you would apply the shampoo to wet hair, lather and leave on for a few minutes, then rinse thoroughly. It is recommended to repeat the treatment after 7 to 10 days to ensure all lice and their eggs are eliminated. This shampoo is safe to use for adults and children over 2 years old. Always follow the instructions on the product label and consult with a healthcare professional if you have any concerns or questions about lice treatment. It's important to carefully follow the instructions provided by the manufacturer for your lice treatment shampoo Scabicides and Pediculocides. If anything is unclear, it's best to consult with your doctor or pharmacist. This medication is meant to be used externally only, so be sure to avoid contact with the eyes, nose, mouth, or vagina. If the product does come into contact with these areas, rinse with plenty of water. If irritation occurs, seek medical attention right away. Avoid using this product on eyelashes or eyebrows, and if you need to use it on an infant, be sure to cover their hands and feet to prevent accidental ingestion. For optimal results, apply the medication in an area with good airflow, such as near an open window. Apply the lice treatment shampoo Scabicides and Pediculocides to the hair and scalp, thoroughly covering the affected area. Work the product into a lather with a small amount of water and leave it on for about 10 minutes, or as directed by your doctor. Afterward, rinse and dry with a clean towel, and use a nit removal comb to remove any lice eggs from the hair. It's important to wash your hands immediately after use. Since this product does not affect lice eggs, it's recommended to repeat the application once 7 to 10 days later to kill any newly hatched lice. Be sure to inform your doctor if your condition persists or worsens after the 2 treatments with this medication. If you experience skin irritation, it's important to let your doctor or pharmacist know. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Serious allergic reactions to this drug are rare, but if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to remember that this is not a complete list of all possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you're in the US, you can call 1-800-FDA-1088 or visit www.fda.gov/medwatch to report side effects, and if you're in Canada, you can call 1-866-234-2345 to report side effects to Health Canada. Before using lice treatment shampoo Scabicides and Pediculocides, make sure to inform your doctor or pharmacist if you have any allergies to pyrethrins, piperonyl butoxide, chrysanthemum, or ragweed, as this product may contain inactive ingredients that can cause allergic reactions. Also, let your doctor or pharmacist know about your medical history, especially if you have any skin infections. If you experience constant or hard scratching of the skin or scalp, it may lead to a bacterial skin infection. Notify your doctor immediately if you develop worsening redness or pus. If you are pregnant, only use this medication if it is clearly needed. It's important to discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. When using lice treatment shampoo Scabicides and Pediculocides, it's important to be aware of potential drug interactions. These interactions could affect how your medications work or increase your risk for serious side effects. To minimize these risks, it's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Be sure to share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of lice treatment shampoo Scabicides and Pediculocides. Always follow your doctor's recommended dosage and timing for the best results. It's important to note that lice treatment shampoo Scabicides and Pediculocides can be harmful if inhaled or swallowed. If someone has overdosed and experiences serious symptoms such as passing out or trouble breathing, it's crucial to seek immediate medical attention. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Symptoms of overdose may include nausea, vomiting, diarrhea, and unusual drowsiness. Always use this medication as directed and keep it out of reach of children. If you have any concerns about the proper use of this medication, it's best to consult with a medical professional. It's important not to share this medication with anyone else unless your doctor tells you to. To avoid passing lice to someone else or getting them again, make sure to wash all headwear, scarves, coats, and bed linens in hot water and dry them on high heat for at least 20 minutes. You can also dry clean these items, seal them in a plastic bag for 2 weeks, or spray them with a disinfectant that kills lice. Don't forget to soak your brushes and combs in hot water for 10 minutes, alcohol for 1 hour, or throw them away. And be sure to thoroughly vacuum furniture and floors. If you're in close contact with someone who has lice, such as family members, it's a good idea to check for lice and nits on them as well. Treatment may be necessary even if live lice aren't found to prevent infestation. If you forget to take a dose, make sure to talk to your doctor or pharmacist for advice. Make sure to store the lice treatment Shampoo Scabicides and Pediculocides at room temperature and avoid freezing it. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to dispose of it properly by consulting your pharmacist or local waste disposal company. Do not flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.